Ladies and gentlemen, welcome to NIK NIKAM Network Talk Show. I am Dr. NIK NIKAM, your host. Here we focus in depth on one or two topics that are of interest to you. If you'd like to be a guest on our program, please contact us at 281-265-7567. If you want to advertise or promote your products and services on NIK NIKAM Network Talk Show, please contact us at 281-265-7567. We are coming to you live on 1050 AM KCHN, Houston, Texas. You also can listen to us on kchnradio.com. I am Dr. NIK NIKAM, your host, and we will be right back after these messages from our sponsors. Good morning, ladies and gentlemen. Welcome to NIK NIKAM Network Talk Show. I'm Dr. NIK NIKAM. We got a fantastic program planned for you today. During the first half of the hour, we're going to be talking about breast cancer awareness. We're going to talk about how to detect breast cancer early and how breast cancer is managed and how breast cancer can be prevented. And during second half of the hour, we're going to be talking about some interesting clips from the Hindi Sammelan that we had during the Holi season, and we have two audio clips which we're going to play. Stay tuned. You're listening to 1050 KCHN, Houston, Texas. This is NIK NIKAM Talk Show. We'll be right back after these messages, and we're going to start with my special guest, Dr. Arvind Bhandari, and I'll introduce him in a minute. Ladies and gentlemen, we thank Atrium Medical Center for their support. They specialize in senior care, advanced wound treatment, and outpatient services. Please contact Atrium Medical Center at 281-207-8200. We also want to thank Imran Moideen at the South Texas Vascular Institute, where he specializes in arterial and venous diseases. You can contact Imran Moideen at 713-955-1707. Sugarland Heart Center has been supporting this NIK NIKAM Network program since its inception, and Sugarland Heart Center provides complete cardiac care, including diagnostic studies and treatment. You can reach us at 281-265-7567. Okay, ladies and gentlemen, welcome back to NIK NIKAM Network, and we're going to be talking about breast cancer. And my special guest is Dr. Arvind Bhandari. He is extremely well known in the Sugarland area, Indian community, and all across the Houston area also. Arvind, welcome to NIK NIKAM Network. We're delighted to have you, and give us a little bit background about your training and all this.
Yeah, thank you, Nick, for inviting me, and it's a pleasure to be on your program. I'm one of the old timers.
Don't say that.
I've been in Houston a long time. I
can say that I'm bald-headed.
yeah, I'm losing some hair too. So
yeah.
I first came to Houston in 1976, mainly to do my training in medical oncology at MD Anderson Cancer Center.
Yeah.
And originally my plan was that after the training I'll move on to California to greener pastures.
Oh, I see.
But after I finished my fellowship here and got to make a good social circle of friends here, we decided to stay in Houston. And I've been in practice of medical oncology here in Houston since 1978.
78. That's a long time.
It is a long time.
Okay, so you must have seen all kinds of cancer patients in your whole 35 plus years.
Yes. Yeah. When I started practice, there were not that many medical oncologists.
Yeah.
Now it has become a real bona fide, certified specialty, and there are more oncology setups in different hospitals, even in the community.
Yeah.
And that's what we take pride in, is providing the high level of oncology care in a community setting, so patients don't have to go to the medical center for getting the cancer care that they need.
That's fascinating. You know, one of the reasons I picked breast cancer is because, as you know, just about a month ago, that was on March 24th, Angelina Jolie, she wrote an article in New York Times saying that she had bilateral mastectomy and oophorectomy and all these things. I thought, to me, that was a huge, huge radical surgical approach to what a condition where she didn't even have documented breast cancer. So I thought maybe it's the best time for you as an expert to talk about breast cancer. You know, how do you detect all these things? So let's start off with what is cancer?
Yeah, cancer basically is uncontrolled growth of some of the cells that are normally present in our body.
I see.
So there's something happens in those cells,
Yeah.
some genetic mutation that happens that make the cells to multiply out of control.
I see.
And not only that they multiply in the area where they start, then they have a tendency to break off from the
Yeah.
where they started
Yeah.
and then spread to other parts of the body. That's what we call as metastasis.
Yeah.
And so when that regulation in the body to control the or regulate the growth of the cells is lost, that's when we have the cancer cell. And it can cause havoc. Wherever those cells go,
Yeah.
they can continue to grow over there, and then they cause problems in the organ that they metastasize to.
So I know cancer can occur in brain, lungs, heart, kidney, not so much in heart, surprisingly.
But it has been reported in
has to be,
heart also,
in
though it's the
muscles,
least common.
bones,
Yes.
joints, everywhere. And but breast cancer is something special because a lot of times people may not have any kind of symptoms whatsoever.
Yes. See, when the cancer starts, it starts from a single cell.
Yeah.
And when the number of cells is very small, then it may not cause any symptoms.
Yeah.
So by the time the symptoms happen, the cancer has already been in the body and grown to a size which is considerable. So the
I
number
see.
of cells could already be in billions and billions by the time when the patient has some symptoms.
Okay, how prevalent is this breast cancer in the United States and especially in the Desi population?
Breast cancer is the commonest cancer in women in United States.
I see.
Right after maybe skin cancer, which
Yeah.
is not the invasive type of cancer.
Yeah.
But out of the invasive cancers, breast cancer is the commonest. And if you look at the statistics, 1 in 8 women would have a chance of developing breast cancer during their lifetime in United States. In India, the number of cases of breast cancer is rapidly rising.
I see.
And the numbers are still relatively less compared to the American population. But the disturbing thing in the Indian population is that the number of deaths from breast cancer is disproportionately high in Indian women as compared to the American women. Just to give you an idea, the annual new cases of breast cancer in America, the number is about 230,000. And out of those, there are 40,000 deaths due to breast cancer. In Indian population, the number of new cases is less, is 144,000 per year, but the number of deaths is 70,000.
I see. So much more aggressive, I would say, the disease process.
It's not only that the disease is aggressive, but it is caught at a later stage. It's diagnosed at a later stage. So by the time the patients are diagnosed, it has already metastasized, and then the prognosis is poor as compared to when it is diagnosed. And
that's kind of interesting. As a cardiologist, I have to say I've been in practice for 30 plus years. So the incidence of heart disease is something like 1 in 5 as we get older. So your breast cancer is almost close to
catching up.
Catching up.
Yes.
And there are about 400,000 people who die from heart or cardiovascular diseases, which would include all kinds of problems, not just necessarily heart.
Right.
So I think that's a pretty high number to begin with.
Yeah. See, one thing which has been studied is at one time the rate of breast cancer was rising rapidly.
Yeah.
And then the association with the hormones,
Yeah.
women who were taking estrogens
Yeah.
and progesterones after menopause, that was incriminated in the cause of breast cancer, and that was stopped or
I see, yeah.
minimized. So since then, the incidence of cancer has dropped,
Yeah.
but now it is sort of stabilized. But the good thing in American population is that the number of deaths from breast
Yeah.
cancer has been going down,
I see, yeah.
which is the opposite what is in India,
India,
that
yeah.
the number of deaths is rising, and the incidence also is rising.
Right,
Incidence
yeah.
is expected to rise
That's right.
mainly because of better diagnostic techniques,
That's
people
early
being aware of
diagnosis,
the diagnosis and going to the
Yeah.
doctors, yes.
Ladies and gentlemen, you're listening to NIK NIKAM Network Talk Show. I am Dr. NIK NIKAM, and my special guest is Dr. Arvind Bhandari. He is a cancer specialist. He's been in practice for 3 decades plus. And that brings me to the next question. What are the risk factors, or who is at risk of developing breast cancer?
Yeah, obviously all women, they have to be careful that
Yeah.
there's nobody is immune to
I see,
developing developing breast cancer, but there are certain groups of women who are at a higher risk.
I see, yeah.
And some of the risk factors that have been identified in breast cancer, one is obesity or
Yeah.
being overweight,
I see, yeah.
and lack of exercise. So this is one of the
Yeah.
factors which is easily preventable.
Yeah.
The other factor that has been identified is alcohol.
I see,
So women who use more than one drink per day,
yeah.
they have a higher incidence of developing
This
breast
may be
cancer.
a very important point, because the new generation, the X generation, the next generation, or Gen generation, all our kids and their friends, they think alcohol is part of this whole new social makeup. So
exactly,
this is a
that's-
very good message here.
Yeah, that's very true, because you remember during our time when we
Yeah.
were in India, it was rare
Yeah,
to see women drinking.
That's right.
And now you look at the Bollywood movies, and everybody is
Yeah.
holding a glass
Holding-
of wine
yeah.
and celebrating by drinking.
Yeah.
So it is becoming a lot more prevalent and an accepted social norm,
Yeah.
which, if it is kept within limits, it's okay. But if it goes beyond the limit, then it does pose the extra risk. Yes.
You were talking about hormones. We'll get back to the hormones. Let's talk about genetics, because this is what got my attention when I read this article from Angelina Jolie. Let me see if I can find out here. She had this BRCA1, BRCA1
Yes.
gene, which predisposes her to the risk of cancer by 87% and 50% risk of ovarian cancer.
Yeah.
Let's elaborate on that one. This is a pretty serious
Yes.
problem.
Yeah, I think now that we have a lot more availability of the genetic testing,
Yeah.
and the human genome has been mapped, so
Yeah.
we're going to get more and more information about the connection between different type of genes and different
Yeah.
type of diseases, including cancer. The gene that is connected to development of breast cancer and ovarian cancer, there are 2 genes.
I
One
see.
is BRCA1 and the other one is called BRCA2.
BRCA2, yeah.
And so both of these genes, they cause increased risk of breast cancer and ovarian cancer.
I see.
And the BRCA1 gene
Yeah.
has a higher incidence, has a higher penetration of the mutation, and the risk can be as high as 70 to 80% chance of somebody developing breast cancer.
Yeah.
And with BRCA2, the risk is a little bit smaller. It's more in the range of 40 to 50%,
I see, yeah.
but it is still a
Yeah.
very high percentage.
So there's a very significant correlation between some genetic factors or hereditary
Right.
that can predispose a woman for breast cancer.
You're right. Yeah.